Unpopular opinion warning coming in. So when it comes to fertility and your reproductive potential, should you get your fertility levels checked prior to conceiving? My opinion is no, you should not. And most people might think that doesn't make sense because don't you want information? Don't you want to know things about yourself and your ability to make decisions about your fertility and whether or not you want to start a family? Yeah, you do want to have information about that. And that's exactly why I say no, because testing does not give any information. I'm Dr. Monica, board certified OBGYN and Mama 3. And in this video, I want to talk to you about some of the testing that is done for fertility and why not only myself, but the American College of Obstetrics and Gynecologists and the American Society for Reproductive Medicine do not suggest getting testing for your fertility levels before trying to conceive. So why don't I think that you should get blood work and check out your fertility levels, your egg reserve, your potential for reproduction before you try to have a baby? Or maybe even use these things to decide if you might want to consider things like egg freezing and embryo freezing. We're going to talk about some of these different tests that are done to evaluate fertility, okay? So first of all, when we think about evaluating fertility, there are a few tests that come to mind. And in the situation we're talking about, we are talking about someone who has not been shown to be infertile, meaning you've not been actively trying to get pregnant for a year, you've not had a fertility workup, you've maybe had a baby before, or you've not even tried to have any babies yet, you've not tried to conceive. That is what we consider a population that is not proven to be infertile. You may have incredible reproductive potential, you haven't really tried yet. And I see on the internet a lot, I lost many hours of my life going down a Reddit thread about testing fertility levels, and I see all types of products out there that are trying to be sold to you to test your fertility levels to see what your reproductive potential is. The tests that are most significant for looking at fertility and what most people think of when it comes to testing your fertility potential are, first of all, one called AMH, or anti-Müllerian hormone. So this tests in general your egg reserve, your ovarian preserve, like how much ovarian potential, egg potential do you have, is a general idea of how to think of that test, which we will call AMH. So you want this level, it's a blood test that's done on cycle day 3. So the day you get your periods, day 1, cycle day 3 would be 3 days later. You want this result to be greater than 1, and generally it's less than 10. So somewhere between 1 and 10, and you want it on the higher side. Now, this test, what it truly can tell us information about is how well your ovaries would respond to being overstimulated if you were to undergo like an IVF cycle. That's the only real information that can come from that value. Another test that we often look at is something called FSH, or follicle stimulating hormone. So as you can imagine, that works to stimulate the follicles in the ovaries to make eggs and ovulate and do all the things they're supposed to do. So this value will increase as we get closer to menopause. So we want a low value of FSH. We don't want it higher than 10 in a general scale to make it easy to remember. So we want a high AMH, a low FSH. Another thing that can be looked at is your antral follicle count, or AFC. This is something done by ultrasound to look at what the deal is with some follicles on the ovaries. A little bit more difficult to evaluate because you have to have an ultrasound done with someone trained to look at those type of follicles. So this is not something that I see as frequently done with like just lab work and blood tests and that type of thing. So for the most part, we're talking about the AMH and the FSH. It seems simple, like why wouldn't you just get those tested to see if they look like they're where they should be? Well, the reason is that research has shown that in that population of women who are not proven to be infertile, those levels being normal or abnormal don't make a difference and don't tell us anything. There's been studies where women have had abnormal levels, so higher FSH, lower AMH, and they had equal pregnancy rates and success with conceiving as ladies who had normal levels. So this tells us that in this population of ladies who are not infertile, a value there doesn't mean anything. If the values are abnormal, it doesn't mean you can't get pregnant or mean that you don't have a lot of time to start a family. And if they're normal, it doesn't mean you're necessarily all good to go ahead and have a baby or that you have more time. It really just gives us no information at all. And so you might say, well, okay, so it doesn't necessarily mean anything. Well, why can't I still get it done? And my answer to that would be that the potential harm that I see in it is that if you get a value that is normal and you take reassurance from it and you feel like you can wait to start a family, well, what if that wasn't accurate though? What if you actually don't have as much time and you get this false sense like you have all this time to start a family? And if it's something that really means a lot to you and something that you really want, I think it'd be harmful for you to delay it because you think you have time based on labs that are not relevant and don't actually mean anything. Now, conversely, if you were to get these labs done and they are abnormal, or they would suggest that these labs are going in the wrong direction, this may put unnecessary pressure on you and stress on you and make you feel as though you don't have time to start your family, you need to start now, or might alter your plans where you start trying for a family prior to when you would have done it before, and in actuality there may not even be a problem there. And in fact, studies have shown that the more significant indicator of your fertility is just your age alone, because we know that fertility declines as we age, significantly after 30 and then more significantly after 35. Just your age alone is more telling for your reproductive potential than any of these labs being done. So the American Society for Reproductive Medicine specifically says that these fertility markers should not be used to help determine or help make decisions based on timing of starting a family, or to help make decisions on whether or not someone would want to pursue egg freezing or embryo freezing. They specifically say not to use it for that, because it just isn't accurate information, and you shouldn't make such important decisions on information that's not accurate. So I see a lot out there, things that you can purchase to check these levels at home. So a few comments on that. All of these things are trying to sell you something, and someone trying to sell you something doesn't necessarily mean that they're bad or wrong, but what I would tell you to think about when you're looking at a product is which came first, the product or the problem. If there's a problem that someone identified and made a product for, that makes sense. There's a problem and they found a solution, and that's a good way of doing things. If a product was made and there's not a problem, or they're trying to convince you there's a problem, you always have to consider that a little bit of a red flag and think twice about it. So these things were made to, home test, saliva test, blood test, to test these levels. But what's the problem? If you've not tried to get pregnant yet, you've not been diagnosed with infertility, there's no problem, there's only a product. So always consider what the motive is for trying to sell you these things. Another thing to consider is that this whole topic is an extremely vulnerable topic, because with all we see nowadays about declining fertility and people needing IVF and people seeing things amongst their friends, it's easy to feel nervous and insecure about your reproductive potential. So it's a very vulnerable population that is targeted by some of these products to try to get you to buy them and test these reproductive markers that are not even significant. So keep in mind, FSH, AMH, antral follicle counts are not significant for predicting your reproductive potential. So that's it. That's the unpopular opinion. I welcome some comments. I would love to hear what other people think about it. And I think the most common thing that comes to mind is, well, I just want to know. And what I would just tell you to remember is that for those specific tests, you won't know. You won't know either way. Even if you get testing done, that information does not give us anything, any knowledge, or any idea about your reproductive potential. It only has the potential to misguide you in your decision making. So if this is something that you're worried about or have been thinking about, talk to your doctor about what they recommend. A preconception counseling visit is fantastic to talk about your health risks or not risks, if you're doing things right to prepare for a pregnancy. There are all types of things you can talk about with your doctor in a preconception counseling visit. Thanks for watching. If you found this information helpful, please drop a like to help some other people find it and learn from it too. Otherwise, I will see you next time.